Hello, class. Now we're going to start with the community health class. And I think my first lecture yesterday was kind of dealing with the coronavirus that we're dealing with. And again, we have to be very, very careful. Follow the basic guidelines so that you don't fall victim of this disease. Do your part. So today, okay, the introduction to community health and public health. As we know, much progress has been made in, say, in the past 100 years in health and health expectancy. People, scientists have worked very hard to discover the causes of diseases, the link between various type of microbes, bacteria, and viruses that cause various diseases. So with the research, they've known the link between the virus and the human being. And they've also known the transmission, how these diseases can be transmitted from the host to the victim. So, or how can the pathogen, the virus, the bacteria can get into a host, and that host can transfer it to another individual. So research and technology have done played a great part in trying to come up with some of these basic things that we need as human beings to prevent us from getting sick. Now that they've known how these diseases can be transmitted, is come up with ways how they can be prevented. So going back to just what I was saying in the first, the COVID is known to be a virus. COVID is airborne, can live in host, can live in people, in their body. COVID can be transferred through droplets. As we talk, we spew, certain droplets comes out of our mouth. And if you are infected with the virus, as you talk, those droplets are exposed to the air. And if somebody is around who is not infected, but close to you, less than 6 feet, most of the time that person inhales that air with the viral load, then that person who was not infected becomes infected. So it's to break the chain. And science has done a lot to be able to do that. Thank God they've been able to do that, or else, in terms of this virus would have killed far more people, even though it has killed far more than expected, but it could have been worse if people don't know how to at least mitigate or prevent the transmission of the disease. So that is one of the things that when we talk about public health, See, the main thing about public health is to improve the health of the public through research, through activities, and at times through certain policies that are put in place to, to avoid the spread of disease, or they avoid the spread of toxic that can affect other people, like smoking. Again, these are all things that public health brought into the forefront to to control. Then you have, okay, are we done with is public health and the research and all that we have today? Have we done everything that we can do to continue to completely wipe away all diseases? No, there's still room. There's still room for some improvement, because at times, even though the some of this it, some of this the technology has been advanced and people know, but at times also there is also the issue of resources, to making sure that those other people who live in underserved communities have equal access to the interventions that have been developed. Because it doesn't make sense if all this, like right now, if those people that are underserved, those minority groups, if they don't get the vaccination or the vaccine for the COVID, the advancement of science and whatnot does not mean a damn thing to them, because they are not included, or they do not get the value of the amount of research that has been taking place. So part of the is resources. Again, everything in a capitalist state, in a capitalist country, there are a lot of things that are guided, that are promoted by resource. You have it, you get it. You don't have it, you may or may not get it. So that is, there has to be a will, a sheer commitment by leaders, by community leaders, by politicians, by scientists, to make sure that some of these needed resources are shared with all the population, regardless of color, race, or what sort of community people find themselves in. Okay, the achievement of good health is worldwide. Okay, it's still a goal. It requires individual actions to improve. Yeah, again, it's we can have all the information, but if people don't really take advantage of some of those information to improve their own health, then most of the time it becomes very, very challenging. So therefore, I think it is very important for people, first of all, to know, have the relevant information that they need, and also have the required resources for them to use to improve their own personal health. Because if the resources, if the information is there, but the resources needed to really use those resources, then it becomes a real challenge. And people have to take charge of their own health, do play a part in their own overall health, stay away from behaviors that can make them sick. And communities also have to provide those services that people need to improve their health. Clinics, playgrounds, hospitals, and yes, doctors, nurses, people who are really committed in serving everybody, people who are committed, especially a country like America, people who are committed to diversity. I say because America has so many diverse groups, and for her to be able to really do most of the things that is needed, we have to have people who are committed to addressing the gap of inequality in the health of various communities, various people within the country, and also the diversity, disparities. See, because even right now with the COVID, you see how many people who are of color dying out of this COVID. In terms of number of people who have died, you have more people of color that have died than those of white. Why? Some of the issues can be yours. This delayed for so long, people of color have been dealing with health related issues that have not been addressed. So there comes COVID. First of all, the body is already weak because of dealing with other health related issues. So with COVID, it's very easy to just take them out. It's a shame. But it's not that okay, people's minorities and their health is innately poor. No. If they start with the right resources, with the right education, with the right opportunities, they are just human beings. You have some people with poor health, just their biology is just poor. That exists between white, brown, pink, whosoever. Some people, their genetic makeup, but it's not because their color, therefore, no, or their socioeconomic status. You see, it's because of their socioeconomic status that contributes to these negative outcomes. 20th century achievements in public health. As I said, okay, we talked about vaccination. Thank God, because vaccination has helped greatly in improving infant mortality rate. People died, children died very early because of infections. Well, with the advent of vaccines, the advent of antibiotics, people are now surviving infancy and also able to withstand other issues. A good example, even right now, with the going back to the COVID, we were all waiting for the vaccine to be developed. Luckily, it has been developed, and now there is the possibility of people surviving, more people surviving the COVID infection. Then you have motor vehicle safety. Now, if you look at the way cars, trucks, and all vehicles are being built, there are a lot of safety precautions being put in place. Some of it is just the body of the car is much stronger. Now you have safety belt, because if you don't restrain yourself when you are in the car and you are involved in an accident, the possibility for you to be thrown out and smashed is very high. So now people get involved in accidents. The airbag in the car explodes to keep the passenger or the driver away from hitting themselves against the frame of the dashboard. These are all technology. These are all the advancements of researchers, people who have worked hard to improve the quality of life. The control of infectious diseases. Again, now people know how these diseases, first of all, they know the microbe, and the pathogen that causes some of those diseases. So the next thing is to control. Say, for instance, like mosquito, you do away with stagnant water, because when the water is stagnant and humid, you have a good place for mosquitoes to breed. So what has been done, people do away with stagnant waters, or they have pesticides that can kill those mosquitoes. And you also have other sort of infectious diseases like STI, those sexually transmitted infections. See, these are all things that's now under control. You have the penicillin that has been extremely helpful in addressing some of those issues. You have the decline of death from chronic heart disease and stroke. Now, when people check their cholesterol, they make sure that they find ways to make sure that they don't put their cholesterol under control, or else, if not, it will clog their blood vessels, their arteries. And when those things are blocked because of the plaque from cholesterol, you lead to a situation wherein the flow of blood is restricted, and in some cases the heart has to work so hard to supply blood to the rest of the body, and the muscles of the heart, the muscles within the heart just give out. Or in some cases, because of stroke, you have blood capillaries in the brain break. And when that happens, a stroke occurs, and that can more or less, in some cases, depending on the nature of the stroke, it can either kill the individual or paralyze, make them disabled in those parts of the brain that has been affected, those parts of the brain that controls the area that has been affected. So now it's one of those people. That's why you have to make sure that you do away with fatty food. You you also make sure that you exercise, and that can help you. Healthier mothers and babies. Again, this is also another very important. So when a mother is healthy, most of the time the probability of the baby to be healthy is very high, especially during in vitro, when the baby is in the mother's womb. What the mother eats is what the child eats. And depending on the lifestyle of the mother, that has a direct impact on the child. A very stressful mother gives rise to a kid that will be stressful. A mother who during pregnancy drinks a lot of alcohol, you have a child who is going to be born with a low birth weight and some other issues, and also a lot of other mental issues. So it's extremely important for when women are ready to be pregnant to make sure that they stay away from unhealthy habits, which include what they eat, what they drink, and worst of all, don't smoke. Because these are all things that are going to impact the child directly. And I used to joke, when you are having your first boyfriend or first girlfriend's visit, to visit you in your apartment for the very first time, you try as best as possible to clean everything, put things away, make everything look good, because you want to create a good impression. Mothers should also, especially those who at times are not as responsible, think about when they are really planning to have a child, is to make sure that they are healthy. They adopt healthy habits, adopt healthy eating habits, so that when the child lives within her, the child will also be eating healthy, experiencing healthy the environment. So because again, those are the sort of problems that babies are born with some challenges simply because of the behavior of the mother. And some of those challenges are purely related to the mother's behavior or experiences or challenges. So at times they can be, it's easy to blame, but at times, as a society, I think we can do also better to make sure that women are given the necessary support that they need, the necessary respect, the appreciation that they are, so that they can carry, they are the only one that are capable of carrying a healthy child. But the environment, the partner, the husband, boyfriend, everybody should make it possible for that to happen. Safer and healthier foods, yeah. Now there's a better way. People are now then check and see if the food is not healthy, or if every now and then you hear this, okay, certain things have been pulled out from the grocery stores or from stores because they've detected something unhealthy about it. See, whereas you now have people who are checking the food that we eat to make sure that it's safe. Safer workplace. See, create an environment wherein it's safer so that you reduce the possibility of accidents, and also create an environment wherein people feel respected. See, because when people are respected, they tend to be much more happy, or they tend to be happy doing what they are doing. And also make sure that you provide good salaries and also good times. See, part of making the workplace safe is to making sure that the work hours are also appropriate. And if there is any problem, you make sure that the workers are well protected. You see, going back to when this COVID started, most workers in some of these food plants, food preparation plants, had some issues because some of them did not have the right gear, the right protective gear that they needed to keep themselves safe. So, doctors, nurses, workers in the field, all those places need to be made safe for people to be able to do their work in peace. Because when it's not safe, people get injured, people get infected, and if you don't watch it, they die. Family planning, again, it's one of those situations, it's purely within the family. How many kids do you want? At times, depending on your value system, you decide some of those issues, because you always have to make sure that, okay, every child that is to be born to this world is a child that should be well loved. There's no mistake. Say at times, oh, this child it was a mistake. No, you know, when a male and a female get together, engage in sex, if the female is fertile, pregnancy is, and also the male has healthy sperm, pregnancy is very likely to occur. So the idea of it as an accident is this, no, it's not. You just have to be smart about it. Fluoridation of drinking water. Again, this has helped dealing with our tooth. Greatly help in dental health. Fluoridation When fluorine is added into the water, it helps to improve the quality of the water, and also it helps to improve our dental health. Because when your dental health is very, very important. And in most cases, when your mouth is not healthy, it becomes the gateway for infections to enter the body. So fluoridation is very, very important. These are all things that within the 21st century are now in place. And some of these keep adding. Recognition of tobacco as a health hazard. Again, tobacco has been known to cause cancers. Tobacco has been known to contribute to people developing cancer. Yes, you might say, okay, my grandfather smoked for all these years and he's 97 and he has no, yeah. But they say, we are not saying, okay, you smoke, you have cancer. But if you smoke, you have a high chance of developing cancer. And especially if for a pregnant mother smoking, very big chance for that child to be low birth weight and have other health related issues. Okay, these are added achievements. This you can read from in your book. Okay, now we come to the definition. Definition of health can mean different things to different people. A dynamic statement or condition to the human organism that is multidimensional in nature, a resource for living, and results from a person's interaction with an adaptation to his or her environment. It means so much. Break it simple. Health, there are various dimensions, contributing factors. The environment in which you live will play a part in your health. The social interaction you have with people will play a part in your health. Plain simple. And also, yes, your biology, things that you inherit, your overall makeup can play a part. So that's why it's multidimensional in nature. There are so many factors that contribute. And if you look at it's also not only multidimensional, but it's also multidiscipline. It's also multidisciplinary. There are a lot when you really want to study health, especially health education, or you have to understand, okay, what part does sociology play in one's health? What part does anthropology plays in one's health? What part does philosophy plays in one's health? And what part of psychology that plays in one's health? So all of this part, all of these dimensions, all of these disciplines play a part, and you will understand them as we continue with class. Here are some of the determinants. Please make sure, understand this, because if you understand this, these circles, with health in the middle. They are all interconnected. You start with the gestational environment. That starts with in vitro when the child is in her mother's womb. We just discussed that some seconds ago. What does the mother put in? What is the health of the mother? Because if the mother is not healthy, the likelihood for the child to be healthy is not that great. And also, there are genetic dispositions. Say, we human beings come from generations of family, the family tree. And certain families have certain conditions, certain dispositions to certain health conditions. Those things are passed on. My dad had this, my uncle had this, my mom had this. Maybe you have a chance of developing those things just because of the way generations have transferred certain things from one generation to the other. Then you have the social circumstances. What sort of social circumstances? Is there a healthy relationship between people? In America, one of the biggest social circumstances in most cases is the issue of racism. Some people, if you ask them, they will say, "Oh, I'm not a racist. I'm not this. I'm not that." But most of the time, it's their actions. It's what they say. So you think about, okay, last summer, spend a good time dealing with from one black being killed to another being killed, and eventually with all this protest, Black Lives Matters became a driving force, wherein people started saying, you know what, enough of this. The lives of blacks matters just as the lives of whites. See, when people were saying Black Lives Matters, they were not saying, okay, other lives don't matter. But just by the experience that people were faced with, it appeared as if whites did not consider the lives of blacks as being valuable. I say it's not all whites, because even during the marches for Black Lives Matter, there were a lot of whites. But within the group, within our society, there are certain cultures there are certain pockets of whites that are just racist. There's no other way that you can say it. And unfortunately, some of those people are also some people in power, in positions of power. Then you have the environmental conditions, filthy environment, no rain, too much rain, too much heat, too cold, polluted environment, wherein you have the dump, all the dumps thrown into your neighborhood. Too much noise. You don't have the ability to sleep. Always in a very stressful condition. So the physical environment most of the time is also very strenuous. And going back to the social circumstances, because of the stressful environment, the racial attitude that young black men experience on a daily basis, now even young black women, you having some of them developing certain diseases that are usually developed at much older age, like hypertension. They develop those very early. That's stressful. When somebody does not feel appreciated, somebody being harassed, the humanity of somebody not being accepted, it impacts one's health. Then you move to the environmental. I continue again, Here they have this toxic waste being deposited in places where minorities live, people of no means or little means. These are all things that will impact their health. Think of the hurricanes. Most of the time, people with no means live in houses that are not properly built or not built enough to withstand some of the forces of the rain or the wind. So what happens? The houses are demolished and very difficult to rebuild. And unfortunately, that can lead to homelessness, situations like homelessness. So again, this is something that needs to be addressed. Behavioral choices. There is where we talk about the human being, your own choices. You choose to smoke. Do you choose to do drugs? Because it's easy to say, oh, well, there are certain things, yeah, the environment encourages. But one thing that we all have is we have the willpower, the power to say, no, I'm not going to, because I know if I smoke, my health is going to be compromised. Don't fall for that rubbish. Oh, if I smoke, I look healthy, I look slim, yeah. Keep smoking, and when you are at your 40, your voice start sounding funny. By 50, you start having some of these coughs. And if you don't watch it, you might be developing something serious. So don't smoke. Don't use illegal drugs. And yes, it's easy to say don't engage in gangs. But there are certain times wherein, it's better you stay away from all those, especially those gangs that are there to be destructive. No good purpose. Because, certain gangs, depending on their focus, I don't know. But if you know that, okay, they are not geared towards improving your overall quality, improving your value system, maybe you don't need to be there. And also the need for going to school. Education is everything. Being normal helps with having resources, with making better decisions for ourselves and our families. So that, if there is a way, stay in school, go to school, have that education. Because if you have that education, nobody can take it away from you. Even the most racist person can try. But with time they will be exposed. So stay focused on your goals, your educational goals. And at times, yeah, you might be having some hiccups or some distraction by some people. But you know what? Don't let them take your dream away from you. Because depending on who you believe, they are not God. They're just acting stupid. And you don't need to be with them in their stupidity. You need to work hard, stay away from trouble, stay focused. And yes, things can get better. Then you have the medical care. See, there comes most of the time the medical care is there for all, but in most cases, it's also driven by the type of insurance that you have. A good job will give you a good insurance. That's why the value of education is very, very important. Try to educate yourself and try to value the power of a job. Be engaged in a meaningful job, because all of those things with a good work ethics, with a good work attitude, some of those workplaces or those companies or institutions you work for will provide you with a good insurance that can help with your medical care. So you have to play your part. See, because all of these things, as you see, the one, gestational endowment, which is your heredity, is number one. Two, social circumstances, your people, where your community you find yourself in, the environmental conditions, they also play a part. Behavioral choices, they play a part. The medical care also play a part to making sure that you have a good and healthy living. Now here, the definition of community. When you talk of community, most of the time, a community is a group of people who have common characteristics, common interests, common value. Can be defined by location, where they are, by race, by ethnicity, by age, occupations, interest in particular problems or outcomes, or common bond. And these characteristics can be characterized by membership, common symbol system, shared values and norms, mutual influence, shared needs and commitment to meet them, shared emotional connections. See, most of the time you have common membership. You all, most of you belong to, most people belong to different members, that's a community. Your solo, your sorrows and your friends, these are all communities, shared values and norms. You have mutual influence. And you live in certain geographical location. Again, people in Petersburg form a community. Those in certain areas in Richmond, they form their own communities because they have common symbol systems, and they have a mutual influence, shared needs and commitments to meet some of those needs. Public health. What is public health? Actions that society take collectively to ensure that the conditions in which people can be healthy can occur. Most inclusive term, in a way, is the actions that people in a community, collective action. Because let's go with smoking. Smoking, it took some people to really be sick with cancer and other issues. Started with individual, they form group collectively. From there, they form lobbying group, and from that lobbying group, they went to the legislators for policy to be enacted. And once the policy was enacted, certain rules were put in place. People don't smoke in public places, in public buildings. People don't smoke well, you don't smoke in classrooms. And the age of smoking also is an issue. And most of the time, they also have placed a lot of restrictions, like increase the tax for a pack of cigarettes so that you take away some of this incentive, make it more expensive. So these are all. And at the same time, also a lot of educational literature, a lot of educational material showing the destructive qualities, the destructive matters what happens when people smoke, how their lungs are ravaged, and how when cancer gets into it, it becomes a death if not taken care of. You have community health, the health status of a defined group of people, and actions and conditions to promote, protect, and preserve their health. See, again, community health is what people do to protect their health. They get together, they develop resources, come up with resources, come up with educational material, come up with some supportive activities that at the end, those things will improve the quality of health of those people, of that community. Population health, health outcomes of a group of individuals, including the distribution of such outcomes within the group. Other definitions: global health, health problems, issues, and concerns that transcends national boundaries. See, right now, the idea of trying to take care of COVID, we are involved in global health, wherein the health problems and issues and concerns that transcends national boundaries, they all come together to making sure that, first of all, know how the disease is being transmitted, two, what can be done to prevent the disease from spreading, three, what is the cure, and how can this disease be controlled. Now you have this aggressive push for vaccination, because once they identified that vaccine, there are certain vaccines that can be able to deal with this, the spread, reduce or completely do away with the spread of this virus. Those, now the vaccinations have been developed. Now the biggest challenge of global health is, how is this vaccination going to be used? Is it going to be used for only developed countries, countries with the resources, or is it going to be used for developed countries and also underdeveloped or underserved countries? Because this disease is now in every part of the world. So it is the responsibilities of, when we talk of global health, it is the responsibility of those countries with the resources, with the know-how, the knowledge, to develop those things that can be used to improve their health and also the health of underserved or countries like Africa and some other countries in the South America. Because if the cure is only for those with those countries with the resources, then this disease will never disappear from the face of the human population. When we say, because we travel, we interact with a lot of, so the only way you can do it is make sure that everybody gets the, the, the best treatment to do away with this virus. Coming back to our country, America, white, black, Hispanics, Native Indian, everybody should be exposed with the appropriate care to address this condition. Okay, and I'll stop here for today. And please make sure that you read the textbook. And if you have questions, you can either email those questions to me, or I'm sure if you look at the syllabus, my phone number is there. You can call me. See, because what I want you to have a wonderful experience. And those of you who can use Zoom, you can, go and get in touch with me, because at the end of the day is I want you to get this knowledge. You take care.